Good afternoon, everyone. Thank you so much for joining us for the penultimate interview in our series, Equity in Action Conversations with CareerSTAT Champions. I'm Melissa Kleder, Senior Program Manager in the Activate Employers to Make Jobs Better team here at the National Fund. And I'm going to do some quick level setting, but we're going to get to the good part of this conversation as quickly as possible. So, if you are new, it is good to know that CareerSTAT, our national healthcare sector strategy, is a key part of our work to activate employers to make jobs better. And the peer led Frontline Healthcare Worker Champion Recognition Program is key to this work and relaunched last year. And we are thrilled to recognize 8 organizations creating good jobs, building equitable workplaces, and making significant investments in the skills and the careers of their frontline workers. Peer learning is one of the ways we aim to accelerate the adoption of these promising practices. Equity in Action is our way of inviting y'all into the conversation to just get a little taste of what programs and practices champions have in place. And you can use the chat function to ask questions as they come up for you. We may or may not get to them right away, depending on the flow of our conversation, but we definitely want to have some time for you all to be able to ask some questions along and throughout this process of this interview. So, without further ado, let me say that I am very excited to have Ms. Shell Mitchell, the National Director of Workforce Development, here on behalf of Ascension St. Vincent, which is based in Indianapolis. And before we dive into the interview, let's just take a moment to celebrate your emerging champion recognition. So, congratulations to you and Ascension. I know y'all worked real hard to turn that application around.
Thank you.
And so we're so grateful that you are able here to join us today. And joy and celebration is always a key of what we want to do,
Absolutely.
right?
Absolutely. Glad to be here.
Great. Well, thank you for carving out the time.
Mhm.
And, throughout the series, folks have started off by just sharing a bit about their personal career paths. We know that career paths are so important in workforce development. They're top of mind for everybody. But we also know, they're not linear, and particularly for, workforce development, not many of us were, in our early education being like, workforce development is where I'm going to be when I grow up. So I think it's always interesting for us to just dig in and how did you get to where you are?
Yes, that is a very good question. And myself, I had a non-linear, almost unconventional way to get into workforce development. I wish I could say that I knew exactly what I wanted to pursue in high school, but I did not. But my first job was at a nursing facility in Indiana. I worked in the dish room. I hated the job, but I really enjoyed talking to the residents. And after working at the nursing home, I knew that I wanted a career working with people, a career that kind of involved making people better, to help people live out their full potential, basically a career with purpose. So I was blessed to go to college through a special program for first generation college students. And I can honestly say that without that special program, I don't know if I had really got to college or let alone be in workforce development today. But my first job after college was in social services. I started working with juveniles. And then I started in mentoring programs, group home for pregnant teens. And then I think my job at Job Corps, which is a residential program focused on education and training, it really hit the button of this is what I'm supposed to do. And from there, I went to start working for Indiana's Department of Education. And basically, I had the fun job of going around the state helping students make plans for life after high school.
Oh,
And from there, I started working for Ascension. And I transitioned from higher education to health education. And I started doing community programming in underserved neighborhoods. But every time I went to do a community program, everyone asked about jobs.
mm-hmm.
So it's not just about people trying to make sure that they're healthy physically, but they wanted to economically have some type of empowerment. So I started asking our recruiters to join me with these community outreach programs. And one of the managers at Ascension was like, you know what, you're kind of good at that. So why don't you join our team and start working, targeting your efforts on workforce development? And from there, I had my start in Indianapolis, and I was charged with making a comprehensive strategy that incorporated upskilling our current employees as well as providing inroads for future employees. And I can honestly say it's a dream job. I have so much fun helping people connect to careers and then setting pipelines and pathways for them to actually make those desires into a reality. So that's a little bit about what got me into workforce development. And it all started with one little job that helped me see that this is what I'm supposed to be doing long term.
I love that. Thank you so much for sharing. I think, I hear some themes that I've heard a lot throughout the series is one, like the connection to people and being able to help them has been a strong driver, but also opportunity that comes in lots of different ways from structural support, like a program to help first-time college students, which if you've ever been a first-generation college students, you're like, what is happening?
Necessary.
That was my experience going into college as well, right?
Right, right.
And then also this ability to like move and grow within the position, right? Throughout over time,
Absolutely.
you fine tuned those skills that you had, and were able to navigate into something that you feel really passionate about today. And that's
Absolutely.
so great to hear. I love that. So speaking of workers and this idea that you're like, well, I'm offering healthcare and people are asking me about jobs, which is such a smart connection to both kind of the organizational goals around
Absolutely.
population health and patient safety. All of those good things are connected, and like just such an obvious place when folks are looking for support, how might you best be able to connect them? So one of the things that we know for sure is that poll after survey shows that one of the things that are at the top of the list for workers is opportunities to learn, grow, and advance, right?
Right.
And Ascension St. Vincent has several programs to help that. And I would love if you could just tell us a little bit more about the Training Academy and how that really helps the frontline workers with their career mobility.
Absolutely. Well, let me start by saying that as a Catholic health ministry, Ascension has a unique obligation and even a calling that's reflected in our mission to advocate for a more just and compassionate society. And we do that through our programs, our practices, our words, and our actions. And we strive to create a more inclusive organizational structure and culture, which includes providing more equitable career development and employment opportunities for associates as we are helping to remedy healthcare disparities. We believe our frontline workers have the biggest impact on our patients. So in 2018, the leadership and our community investment team, our social responsibility team, decided to take a more strategic approach to promoting community health and doing that through workforce development initiatives. And that kind of translate into employment and education opportunities for community members and upskilling efforts for our current associates. Our business outcomes include career development for our associates. We understand that our greatest asset is our human capital or our workforce. And we wanted to make sure that our associates have the skills they need to succeed in their current roles or in future roles. So we launched the Training Academy as a one-stop shop for careers. Programs included mentoring and tutoring and career exploration and education and even wraparound resources. We started by launching a medical assistant training program for frontline workers who wanted a new career. To ensure their success, we anticipated barriers. We modified learning models. We combined in-person with online instruction. We eliminated financial barriers that often prohibit individuals from pursuing a national credential in healthcare. And since 2018, our program offerings have changed. They now include apprenticeship programs in nursing and in surgical technician. We started with programming at one hospital, and I'm proud to say that now there's programs at 3 different hospitals and in 3 different cities in Indiana. Yes, I know. Time to celebrate. Yeah, that's an
Yes.
amazing accomplishment.
I love that. And it sounds like you used a couple of smart tactics in that, right? A pilot, starting in one place, getting your feet under you, finding out what's working, what's not working. And I'd love to hear, and adjusting the program to meet needs, to understand where folks are coming from. I imagine the global pandemic had some influence on the
Yes, it
type of
did.
programming and the ability. I'm sure y'all got acclimated to hybrid learning and remote
Quickly,
learning
quickly,
very
quickly.
quickly,
Yeah.
um, and
But
being able.
also,
Go
I
ahead.
didn't mean to cut you off, but
No.
also during that time, we kind of learned, where our strengths and weaknesses were. we were strong in having our second tier workers, which is those upskilled workers, working throughout all of our hospitals, but we had a deficit in providing training programs so that people kept their skills in tune to provide that quality patient care that we needed. So I know we had to make a little transitions, we had to pivot and make some adjustments through the pandemic, but it really showed us some areas that we needed to kind of strengthen to make sure that we were best positioned for future success with our workforce.
That's so great. And the ability to change, right,
Yeah,
is really a big part of this work. The willingness to try something new, to iterate and fix it. And healthcare has a lot of programs that come from various ways, whether it's a lean program or other patient safeties where they're trying to modify and become efficient. And the ability to take that lens and apply it to workforce development is really smart, right? It's using
yeah,
a framework that people are already familiar with, but then
yes,
also like not getting stuck in the mud when something's not really working. Um, you
absolutely.
know?
That's one of the great things I love about Ascension. We will try a new idea and program very quickly. So we're not set that there's only one way to accomplish a goal. So we'll try a new initiative, we'll pilot a program, we'll try it in one part of the state, we'll try it in another part of the state, because we want to make sure that our practices are relevant. And as society continues to change, we want to make sure that our processes and practices and even opportunities are changing with the communities that we are trying to serve.
Absolutely. So smart. And so the way, starting this in place and expanding it, kind of what can you tell me about the pilot outcomes or what you learned in that process that made leadership be like, yes, let's expand this, both the type of training, so we're going beyond MAs and looking at surge tech and nursing, but then also going to other locations. Kind of, were they bought and sold for the beginning, or like did we have to make a case?
A little bit of both. So they knew that something different had to happen, but they weren't sold on what that different needed to look like.
Mhm.
So they charged me with, Michelle, we want you to go out and we want you to look at what's going on and what the needs are, and to really dig down to the root of the causes of some of our challenges with our workforce. And as I looked around, I was able to look at our culture. I looked at openings. I looked at training programs. I looked at short-term training options. And then I also communicated and engaged our frontline workers, asked them, what do you want? What would you like to see? What opportunities do you see that you would like to have if you had the opportunity? And then from there, we use that meet people where they are approach.
Mhm.
So we were able to frame a program to anticipate barriers, but at the same time, think about our business outcomes that we wanted to achieve, because we believe they are congruent. So my approach started with incorporating the hallmarks of our Abide framework, which is our appreciation and belongingness and inclusivity and diversity and equity, into our practices and programs and even our proposal. We wanted to ensure that we were using equitable practices as we're trying to reach our high need and our high turnover population. And then we wanted to make sure we created opportunities that were easy to be a part of. So our leaders, they were appreciative to the wide view that we looked at as trying to upskill our frontline workers, and then they appreciated being very frugal and making sure that those programs were low cost so that a large amount and a large number of our frontline workers can take advantage of it.
Okay, so I love that you engaged workers and leaders in this process, right? Because they both matter equally,
Absolutely.
right? Um,
Absolutely.
and so I am curious, in that outreach to those workers, can you think of just an example of something that came from that feedback, that when you engaged workers and like, what are some of the barriers or what it would be you be really interested in, and then how that was put into practice, right? Like something that shifted based on that input, or was part of the design based on that input.
We talked to them about what potential barriers might be, and a lot of our frontline workers said childcare. So we couldn't necessarily pay for everybody to have childcare for their children, but we partner with neighboring childcare centers and after school programs. So we designed two sets of programs. One were in the morning, and then one was in the evening. So if those workers who were working the 3 to 11 shift wanted to be a part of our program, we had something in the morning so that it wouldn't interfere with their workflow. And then if they were working the morning shift, then we created training programs in the evening so that that wouldn't kind of interrupt their workload. And by partnering with these daycare centers, we were able to have these emergency services for them. So let's say their babysitter fell through in the evening. We had a partnership with a daycare center that was across the street from the hospital so that our frontline workers could take their children there while they're having class and then pick them up once class is over. So that's just an example of some of the resources that we did. We had other resources like transportation and food or even uniform vouchers that we were able to provide for the frontline workers because we know that scrubs can be a barrier pain for them. And then for our wonderful organization, we have different colors of scrubs for different jobs. So we want to make sure that if getting scrubs was a barrier, that it wouldn't be anything that would hinder them from being a part of the training program and then transitioning into a new role after they completed it.
Yeah, and I can just imagine laundry is what I think of with scrubs. Like as someone who wants to do the least amount of laundry until I absolutely have to, right? To continuously have to be able to wash. And I know that I've heard some programs where workers are able to use on-site laundry facilities, and like what a huge change that makes for them to not have to spend time at the laundromat figuring out your quarters,
Mm-hmm.
figuring out childcare just to go do laundry. All of that stuff is just a reality for so many folks on the front line and
Absolutely.
other positions, right? Of just how to navigate some of those things. So that's
Yeah.
just, being able to support something that seems pretty basic, right? It seems like, yeah, you need a uniform to work, right?
Right.
But actually it can be a barrier. And like, if it's such an easy problem to solve, why don't we solve it, right? Like, this is a great
Absolutely.
way to like
Yeah. And
remove that barrier.
absolutely. And I really appreciate our leaders who seen that as a potential barrier as well. I know I did because I work with frontline workers, but our leaders were very supportive of providing resources for every barrier that I anticipated. They provided resources so that we made sure that anything that we thought might be an issue or might be a barrier, we addressed it on the onset of the program planning so that once participants actually got into the program, they didn't have anything to worry about.
Yes, that's
It was
amazing.
great. It was great.
So to the audience who's listening and watching us, I just want to give y'all a moment that we're going to be moving into questions. So if you have some questions or want to learn more about some of the specifics of what Michelle has talked about, now is your chance to drop them in the chat and we will get them here. But while y'all are thinking and typing, I'm going to ask another question, which is, when we talk about emerging champions, right? Those are folks who are like committed to doing the work and just earlier in the stages, right? That they have maybe some really good programs, but to get that sustainability, it's in process, right? It's coming along. And so, as someone who is recognized as an emerging champion, I'd love to hear any advice you have for folks who are like, we're in it, but now we have to get it going, right? Like, we've made the commitment. So if for folks who are earlier in that journey, like, how might you get started? What tips or insight might you have to share?
Well, I start with your leaders, because you have to have some sort of buy-in and support, even when you're launching new ideas. So I talk a lot with our CNOs, our nursing leadership, as well as our leadership for medical assistants and for surgical technologists. I talk with them like, where is the need? And then we created plans and pathways so that someone who's already working in healthcare can know what steps they need to take to get to their next role. So definitely collaborating with leaders and then definitely engaging frontline workers and ask for their perspective even before you design the program. Because I've seen, a lot of programs that are designed without considering the work schedules of associates. So, if the program is offering during time when associates are currently working, is not a large likelihood that they'll be enrolling in
Right.
it. So actually asking frontline workers what would work best for you, and then deciding on the type of program to offer. Some programs we offer that were just skill enhancement, and then other programs we offer that actually leads towards a credential. Both of them were identified as needs from our service line leaders. And then you have to kind of decide on the format. We decided a hybrid format works best. So there's some that's online, some instruction that's online, but there's a lot. Most of the hands-on instruction is done on site. That way they can have a balance between what they're learning didactically and then what they can learn in direct practice. And then, kind of determine an equitable selection process. We don't have enough room for everybody to enroll in our program. So kind of determining a process so that everybody has the same likelihood of being in it, and then doing a training calendar, so that if they weren't able to be selected the first time, they know that there's another opportunity for them to enroll and receive the training. So that's just kind of the start of it.
Yeah.
But I want to put a little more emphasis on the importance of piloting a program with a small number, because I believe the outcomes from our pilot program really fueled the decision in our leadership to expand. So our first cohort was 10 students, and 80% of those completed the program and earned a national credential in medical assisting. All of the participants utilized our support services, our wraparound services. I mentioned the transportation and food and uniform vouchers. They all utilized them. And then of the participants, 8 were placed in a MA role. And then leaders were excited to see the data, not just of the participants, but that there were decreases in absenteeism and there was an increase in productivity. And those are things that impacts the bottom line that our leaders were looking forward to seeing. So I think a pilot program and actually launching an initiative initially, getting the results, fine tuning the areas in the program that might have not, achieved the results that you intended, and then launching it for a larger cohort or in multiple locations. That was extremely helpful.
Yes, yes. And you touched on so many things in that advice. I'm going to try and pick up a few that I heard, just to recap. One, engaging your leaders, but finding out what's important to them. Right. It's not just like getting this, but like, how might you pitch it to them? What are they a numbers person or are they a heart person? Usually both, but
Both, yes.
knowing where and what and how to speak their language of what's important to them is an important first step. And in a way that speaks their language is connecting workforce development to those business outcomes, to those business goals, which is often
Absolutely.
a wild oversight in many, many conversations that I've had, right? That like you have whole departments of diversity, equity, and inclusion that sometimes don't even know who the workforce folks are and aren't
Wow.
bridging and thinking strategically about how they might be able to work together and combine resources and people to be able to reach those goals. So that's like 2. And then engaging the people that you're trying to serve, always incredibly important. And some of those things are just really obvious that you could have the best intentions and the most beautiful program on paper, but if it doesn't meet the needs of the people you're trying to serve, then it is useless, right? Like it's not going to be successful.
Basically.
You're not going to
Absolutely.
get the stuff that you need in order to really even actually be able to help the people that you want. And then this idea of piloting and then taking that and creating ultimately a strategy, right? So
Yes.
you have a pilot based on individual programs. You're engaging your other folks in departments to figure out where the high needs are, so you can
Yes.
create those pilots. But then once you have a like proof of concept in that, really
That's it.
expanding and being like, what's our workforce development strategy, so that we're not just responding to this need and this need individually, but we're thinking holistically about
Yeah.
this strategy and how it touches on multiple parts of the organization. Does that feel like a
Excellent summary. Excellent summary. You
great?
you, you summarized
Good.
everything very well.
All right, good. Well, Thank you. You never know how I might summarize on the back end. So I'm glad that I
Very
did
good.
that successfully.
Yes.
I'm just going to do another call for questions. We are coming up close to time. I'm taking no questions, meaning that we did a fantastic job and that just have left
Absolutely.
people in awe of the work that we've been doing. But I do just want to give folks another opportunity to ask questions if they have them. And while, again, folks are thinking, I'm going to just do, because we're close to end of time, just a few announcements, and then we'll come back to close out if we have any questions here. So first, we have a very exciting announcement, and that is that we have created profiles for each of our champion organizations, and they are complete. So they are going to be published tomorrow. You're going to be able to go to our website and see and get just another sense of what's happening in these organizations, what practices they have, and how you as CareerSTAT members might want to engage them or think about what they're doing, and you might be able to bring some of those learning into your own organization. I also want y'all to mark your calendar for our last interview in the series, believe it or not, will take place on Wednesday, September 11th with our friends at Atrium Health. If you have not signed up to attend SHIFT, the National Fund's Biennial Convening, I strongly encourage you to do so. It's going to be September 24th through the 26th, and it is in Memphis, Tennessee, and it's going to be a fantastic opportunity to both learn and connect with people across the field, but also with our champions. They're all going to be there. We're going to be celebrating them. We want you there to celebrate with us and with them. So you still have a chance to register, but it's closing. So you want to do that soon. And then, of course, if you're not already a member of CareerSTAT, I encourage you to join. The network is free to join, open to all who have interest in healthcare workforce development. So that is open to you all. And so I'm checking in to see if we have any additional questions. Michelle, I am curious, as you've been piloting and changing and looking and reiterating the work, when you think about what's coming up, what gets you really excited about the changes that are happening?
I think it was the tale of two cities, that it's the best of time and the worst of times all at the same time, because we have an immediate need. Every health system has an immediate need for credentialed workers, but I think it's the best of times because we have an opportunity to prepare for what's next. I talk all the time about Ascension being prepared and best positioned for future success, and I really believe career pathing and pipeline programs really prepares us for future success. So I'm excited about the future. I'm excited about being able to create programs so that people can live out their full potential, and most of them want to make an impact in the lives of others through the healthcare industry.
Yeah, that's really great. I mean, I think, at a moment of disruption, gives us a real opportunity to take a step back and reflect and think about, are we doing things just because we've always done them that way? Or is there a better way to do it? Or is this based on tradition, or did somebody just really like this program because they had a lot of feelings, they stood it up and they feel really passionate about it, but it's not really meeting the needs. So, while something like that pandemic had a huge impact on the sector writ large, it also opened some opportunity that may not have been there otherwise.
A
Folks
lot.
really having an openness to trying different things, looking at things in a different way, because everything has already been turned upside down, right?
To some degree.
Right. And so as you're putting it all back together, we can decide and take this opportunity to really reflect on if we're meeting the needs, if we're really doing all that we can to meet the goals that we have,
Absolutely.
or if we're just in a rut and not always getting there that we want. So I so appreciate you joining me on the call today, sharing some of the insights and learning from Ascension St. Vincent. Let me just pause. I'm just thinking, was there anything else? But I think it's just accolades. I think we're just at the moment of appreciation, just to
Yeah.
say thank you so much for all of the work that you and your team have
Thank you.
done
Thank you so
thus
much.
far, and we are really excited to continue working with y'all as we can, fine tune the processes of workforce development and building those equitable workplaces.
Hey, we appreciate the partnership. We thank you for being recognized, and we look forward to a future where we're creating more pipelines and pathways for frontline workers.
All right. Well, thank you so much. Love to be
Thanks
on
again.
the same team. Have a wonderful afternoon.